Today we will be talking about the various injections which are used in the IVF cycle. There are two routes of injections which are used. One is a subcutaneous route and one is an intramuscular route. So I will explain both the injections one by one. One is getting ready for the injection. You have to check for availability of alcohol swab, sterile gauze pan, an antibacterial solution to keep the hands clean, the injection itself, and a container to dispose of the sharp objects. We'll begin with the recombinant injection, which is given by a subcutaneous route. Now there are various recombinant injections available in the market. Few are in the pen form and few are in the form of pre-filled syringes. So I'll first explain the pen form. So we've picked up by explaining you the Gonal-f injection. First we'll uncap the injection. This is the portion of the injection where the drug is available. This is the dose meter of the drug. First of all, we'll use an alcohol swab and clean the top rubber portion of the injection. Along with the injections, there are syringes available. We'll open the syringe. A thread-like end is on the other end of the syringe. There is a rubber edge at the end of the Gonal-f syringe. You just puncture it and twist it clockwise to fix it. Then the outer cap of the syringe is removed. Now the injection is ready. Whatever dose has been prescribed to you by anti-clockwise or clockwise motion, that is fixed in the dose meter. Now this is a free clockwise anti-clockwise motion. So if by mistake you fix up a lesser or more dose, you can always twist it and come up to the exact dose which has been prescribed to you. Suppose the dose is 75, so I have fixed up the dose to 75. In the end of the syringe, we'll also check for any air bubble. Now this particular syringe has no air bubble. In the end, I'll also explain if there is air bubble, then what is to be done. So you fix up or into the dose prescribed to you. Open the needle, clean the site of the injection with the alcohol swab and let it dry. Stretch the skin and at a 45 to 90 degree angle, insert the needle as complete. After insertion, push the dose knob completely. And after pushing the knob, count till 10. After finishing, remove the injection and put a sterile gauze piece at the side of the injection. After administering the injection, you have to check that the dose meter shows a figure of 0. If it is not showing a figure of 0, that means adequate amount of dose was not available in the injection. Whatever figure it shows, 12.5 or 0.25, that means that amount of drug has been administered less to you. So you'll have to pick up another injection, fix up that injection to the same dose which was left over and repeat the whole process again. There are few other subcutaneous route injections which are available as pre-filled syringes. So you just have to remove the cap of the syringe, check for the air bubble. Just tap it so that the whole air bubble comes at the top and then press the plunger. Press the plunger till you find a small drop appearing coming out of the needle. Now the injection is ready to be administered. In the same way, at the site of the injection, go in a 45 to 90 degree fashion, enter inside and just push the plunger completely. Once you come out, put a sterile gauze piece. Now there are few injections which have to be reconstituted. That means they have a dried powder and they have a solvent. To open the solvent, take a 2 ml syringe inside and pull the plunger till the whole drug comes inside the syringe. Cap the needle again. Now with the one thumb, uncap the dried powder vial. Clean the top of the vial with the area of rubber with the alcohol swab. Through the central marking in the rubber area, vertically inject the syringe and push the saline inside. With the needle still inside, gently turn the vial. There is no need to shake the vial vigorously. Once the mixing has been done, with the same needle, just invert the vial, and while the needle being dipped inside the solution, pull the plunger outside and keep on withdrawing the needle so that the whole drug comes inside the syringe. Take out any air bubble and push the plunger. Now the needle for the reconstitution and the injection is going to be different. Two kinds of needles available. A longer one for an intramuscular injection and a smaller one for a subcutaneous injection. So the dose prescribed is subcutaneous. You will just fix up this needle on the prefilled syringe and administer the drug in the same dose as described previously. In case of an intramuscular injection, fix the longer injection, open the needle, select the area of injection of intramuscular injection, and in dart-like fashion, inject it. The sharp disposables which you have, like needles, are to be disposed in specialized containers known as sharp disposal containers. Now you will not have such containers at home. So what you can do, whenever you have to dispose of a needle, collect it, keep them collecting in separate box. Whenever you come to the center, you can give those needles to our staff nurse for proper disposal. Please do not dispose of sharp needles in domestic garbage bags. For any other queries regarding administration of the injection, please contact your doctor or the staff nurse in the hospital. Thank you.